Good to go.
Great. Well, good morning, everyone. Today is a Health and Human Services work session to discuss the special appropriation, the county government's FY22 operating budget regarding the guaranteed income non-departmental account in the amount of $1,992,832 for a guaranteed income pilot program. We are joined this morning by my colleague and friend, Councilmember Jawando, who co-led and co-introduced this piece of legislation along with me, with full support of most of our colleagues. But just to give a little bit of background and context, and then I'm going to turn it over to Councilmember Jawando to add some context and background as well. We know that we have very many of our county residents that have been deeply impacted by the virus and by the pandemic over the last 3 years. And guaranteed income pilots are not new. They have been tried and tested in other parts of the country and have been found to be an exceptionally important tool in helping to break the cycle of poverty. When we empower all of our constituents and help them through their extraordinarily resilient acts to support their families and put faith in their ability to make decisions on what's best for their families, it significantly increases and helps these families get back on their feet. And so what we're proposing today is a modest pilot as compared to other pilots across the country, and that we are starting by focusing on 300 families. I'll note that this has been a strong partnership between the Department of Health and Human Services, as well as key partners and stakeholders who we will hear from today, to make sure that this program is tested, to make sure that the families that have been selected are put in the best possible position to take advantage of this important opportunity. And we will track to see how this program goes moving forward. I'll note that in places like Stockton, California, and in other parts of the country, there has been considerable research done on this and similar efforts across the country. And I'll note two final things before turning it over to Councilmember Jawando. The first is that over the last 2 years, thanks to the partnership with the federal government, many of us in our community, regardless of socioeconomic status, have received support directly from the federal government in the way of grants to help shore up businesses and get them on to the other side of this pandemic, or through direct cash assistance, or through the child tax credit, which candidly, my family and I are benefiting from, along with so many others across this country. And what we have found is that this infusion of resources really empowers communities and helps leverage all the programs and services that we're doing in a way that's truly effective. Parents and families that take advantage of this program often use it to advance their education of themselves or their children, often use it to be able to, rather than work 3 jobs, work 2, or rather than work 2, work 1, in order for them to be able to spend more time at home, which has significant social and economic benefits across the board. So we know that this program works, but we're looking forward to this partnership and alliance. Joining us this morning on the panel are representatives from the Collaboration Council, as well as Mr. Julian Haynes from the Meyer Foundation, who's a very strong partner, and Dr. Raymond Kroll, our Director of the Department of Health and Human Services. I'll now turn it over to Councilmember Jawando, whose leadership on this has been instrumental, and I have truly enjoyed working with him and Pam and his entire team, who've been absolutely outstanding and showing tremendous leadership here. And our office has enjoyed working with you, Councilmember Jawando, on this. So with that, I turn it over to you to make some opening comments.
Thank you. I appreciate it, Council Vice President and Chair Albernaz. I'll use that title for a couple more days here until you switch to the other one, which we're excited about too. Good morning to my colleagues, Councilmembers Glass and Rice as well, and to all the panel, Mr. McMillan. It's great to see you, Mr. Haynes, Mr. Mensah, Dr. Kroll, and our great partners at the Collaboration Council. I'll just be very brief. I'm glad we're moving this forward and we're going to get it done before Christmas. It's a really, really exciting program. While these are not new, it's been, Stockton was the first in 2019. There have been guaranteed income or universal basic income pilots across the country. We will be the first in the state and one of the largest in the region to do this. And we were just on a call since we've introduced this. Actually, our partners and colleagues in Baltimore are planning a program as well. And we have been talking to them about how we might learn and work together since we're in the same state. And I know Mr. Mensah, you're going to help us with those benefit cliffs and all that stuff that we're going to get into. But it's just really exciting. And because as Councilmember Albornoz said, this is about how do we relieve the pressure and show that when you give families and individuals, and this will be 300 households, some will be single individuals, some will be families, 100 of which will be on the homeless continuum of care, either experiencing homelessness or recently experiencing homelessness, how this can change and transform lives. I was just reading a story over the weekend, actually. It's fortuitous we're talking about this today, about Compton, which has a similar program where they are giving Compton, California, they're giving $1,800 every 3 months to a residents in their city. And they profiled this single mom who, within a year of this not even being done, she got a car, she got a new job, and she moved into a new neighborhood. And that's the power of just one example of what this can do. And that's what you're seeing in other parts of the country too. You're seeing people use it to get off of public benefit and other resources, and to expand their education and training, improve their mobility, and improve their job and workforce outcomes. And that's what we want. And as has been stated, there are forms of it happening. We've done some in the county of one-time payments here. You have the child tax credit, which hopefully we will be able to extend and build back better. It's kind of hanging in the balance, but that automatic money is helping people right now, but it's not guaranteed for long periods of time. And I think what we hope to prove and show here in the county, not just for these 300 families, is that this is a model for the future of how we can give people dignity, respect, and help them move up the economic ladder and participate in all the great things in our economy and in our state and in our county. So really happy to partner with you, Councilmember Albornoz, and thank you for your leadership. Thank you for the Meyer Foundation for making an unprecedented gift of $1 million, a grant, one of the largest they've done, and they've done a lot in our region, and others who have stepped up to help and more that will. This is going to be a all hands on deck moment. I'm really excited about it. And I think we'll be able to add to the body of research, not only help these 300 households, but hopefully to help to change the dynamic for this going forward in our county and our state. So thank you, and really happy that we're moving forward with this. And thank you for letting me join the committee today.
Thank you, Councilmember Jawando. Councilmember Rice.
Thank you, and I'll be brief. I just want to say thank you to Councilmember Jawando and to you, Council Vice President, and to the Meyer Foundation and all the partners. But I just wanted to let you guys know that everyone is paying very close attention to what it is that we're doing. I just came back from the National Association of Counties Large Urban County Caucus Conference, and I can tell you there that everyone is watching and anticipating what it is that we're doing and the success of this program, because I think that many across this country are looking forward to this. I was talking to our partners in Ramsey County, that's St. Paul, Minnesota, and even there, Tony Carter and Mary Jo Rogers-Stewart, some on the board of commissioners there and their pilot program are so excited about what they've seen that's gone on there with that initial pilot and the potential that's there. But NACO staff, and more importantly, the White House, Julia Rodriguez, who's the director of the Office of Intergovernmental Affairs, specifically mentioned Montgomery County and what it is that we're doing in the course of equity, especially when it comes to what's happening with this guaranteed basic income. So folks at the highest levels across this country are watching and seeing what it is that we're doing here. And so this is just absolutely tremendous. I just wanted to share that with my colleagues, because when we get shout outs about some of the great things that are going on here, and Councilmember Jawando, thank you so much for mentioning, the child tax credit, because quite honestly, that's the president's attempt at starting off this conversation around universal basic income. they're actually not even referring to it as a tax credit, but more as a parent stabilization fund, and really making sure that parents across this country have more money to be able to invest in the things that we know that are important. That's what this GBI is all about. So from that perspective, just again, want to say thank you, to all of the partners that are involved and engaged, and hopefully we can show that there's great success. And last but not least, certainly just want to highlight the fact that we've involved our local education institutions, having Morgan State as a partner, having universities at Shady Grove as a partner. Those are things that are incredibly important to me. And so seeing that folks are there to help in that evaluative criteria, to make sure that that's there. Of course, my alma mater, University of Maryland, College Park as well. It's just tremendous. And so from that perspective, just want to say thank you to everyone. And there's great things ahead, I know.
Great. Thank you, Councilmember Rice. So thank you, Ms. McMillan, for preparing today's packets. Ms. McMillan, was there anything that we missed?
I don't think so. I just wanted to say this is the first installment of the funding. As you know, the county executive, you have DHHS here, but as you know, the county executive is fully supporting this. And also everybody is very optimistic that there's further opportunity to engage philanthropy, given the terrific start we have with the Meyer Foundation. And so the executive has committed to working with the council to make sure that the pilot is fully funded over the next 24 months. And I did just want to clarify for folks that, as you've already mentioned, it'll be for 300 families, 100, and they could be individuals or families with or without children. 100 of the households would be from the homeless continuum, as you mentioned, either currently or homeless or recently exited homelessness. The participants would receive $800 a month for 24 months. And as you've talked already, the evaluation partnership is really critical. I think one of the really important things is that one of Stockton's original goals was to maximize the opportunity to learn. And so one of the things that's so critical in the planning process, which Mr. Haynes and Collaboration Council are leading along with DHHS, is making sure that the evaluation and design are really built into this planning process. And so that's one of the reasons why it's really important to take time to do the planning process now. It's why we can't answer every question from everyone that asks, because we are in this really critical planning process. And so with that, I would just turn it back to you. I would just say in the packet, of course, are some examples of other jurisdictions and information from the mayors for guaranteed income and some information on the Stockton evaluation.
Terrific. Thank you, Ms. McMillan. Dr. Kroll, turn it over to you to speak on behalf of the administration and give any other overview, thoughts, reflections before we dive into the point by point on the packet.
Good morning, Council Vice President Albornoz, soon to be Council President Albornoz, and to other members of Council, Councilmember Jawando. Appreciate your continued support on this, Councilmember Rice, and glad to see you all again this morning. I think that the county executive is, I share, and speaking on behalf of the county executive, and that we are all looking forward to this. This has been a long time coming, delayed, unfortunately, by circumstances, but we are back in the mix and doing this and looking forward to getting this off the ground. Since our initial press conference, we have had several meetings of the work group to try to get us to make sure that we are going to be on path for a program launch in the early part of next year. I think it's going to give us an opportunity. This pilot is going to give us an opportunity to demonstrate that what we can do in a collaborative framework with our partners in the community, and what families can do for themselves and on behalf of themselves, given the opportunity to do so. We saw this early on in our early emergency assistance relief program early on in the pandemic, where we made cash contributions directly to families. And they used that funding to keep themselves afloat and to take care of a lot of other things that were crisis and COVID related, but they managed to use that funding appropriately. We do the same thing with our provider community, with our business businesses, our local businesses over the years. We give them funding and step back and let them manage those resources. I think this is a time for us to do the same thing for our families. There are some questions that we are hoping to answer around this. Can this really help lead people out of poverty? I think we already know the answer from other parts of the world, but how does it apply to Montgomery County? What will be the next steps after the pilot ends? Will the program help people reduce their need for public benefits, making funds available for more people in other programs? How does success compare to other guaranteed income programs around the country? I think council members have alluded to that. My two biggest questions around this are, can we simplify how the county and the state provides essential benefits to people in need, empowering them to manage the resources that we provide to their maximum benefit? If we give them the funding and step back and stop all the silos, can they manage that? And how well do they manage that? And how far can we go down that path? And then lastly for me is, can we leverage this with at the state and federal levels to de-silo benefits that are historically kind of put in buckets and managed? So is there a way for us to de-silo that and step back and give families more autonomy and more opportunity for self-direction of the resources that we provide? So I'm looking forward to this process. It is for me, it is one of the things that was a non-COVID thing that got put on the burner, and I'm always happy to have a conversation these days that is about things that are not about something other than COVID, quite honestly. So that is about how we do our work on an ongoing basis. So with that, I will stop and turn it back over to you, Council Vice President Albornoz.
Thank you so much, Dr. Kroll. I'd like to turn it over now to Mr. Haynes. Thank you so much for joining us, Julian, and the Meyer Foundation's support of this. And again, I want to shout out to Councilmember Jawando, who made this connection and made it happen. But you guys helped take it over the goal line. If you could just describe from your perspective, from a philanthropy standpoint, what your connection is here and how you see this as an opportunity moving forward.
Great. Thank you. Thank you, everyone. It's such a unique opportunity for Meyer Foundation to partner with Montgomery County on this very important work, recognizing that philanthropy alone certainly cannot, address some of these challenges alone. And I think it supports our broader work in the county, where we are really focused on racial equity and systems change work. And it's a unique opportunity to help change the narrative around poverty, around working families, and what it means to have a sustainable living wage and support kids and families. There, as has been mentioned before, there are many guaranteed income pilots across the country that have a variety of different selection processes, criteria, funding sources. Some 100% philanthropically funded, such as in Austin. Some are publicly funded with private support, such as in San Antonio. And with a variety of different public populations. So in the case of Compton Pledge, they focus on returning citizens who are denied benefits, people who are unbanked and undocumented immigrants who are denied a right to a fair minimum wage. Let's Go DMV, a very new effort led by RAG, Amalgamated Bank, IF, ROC DC, among other entities, are focused on low-income restaurant workers. Miracle Money Pilot in San Francisco is focused on homelessness, and Marin Community Foundation is focused on mothers with young children. So additionally, all of these pilots are seeking to answer questions about the potential impact of guaranteed income. And I think what's really most important for Meyer, among many other things, is like, what do we want to learn? What do we want to learn about the impact of guaranteed basic income with regard to housing stabilization, with regard to childcare, with regard to employment outcomes, with regard to health outcomes? So for all of these reasons, we're so very pleased. Meyer was part of some of the original conversations, a number of years ago when this first was attempted to get launched. And I think it took that time to really begin thinking through what all the correct pieces might be to launch this in earnest. And we're so pleased that Councilmember Jawando re-engaged with Meyer Foundation about the possibility of providing philanthropic support for this incredibly important work. So from a broader standpoint, there's a broader kind of movement, national and local movement around economic justice more broadly that I think is critically important to advance. And this is such an important piece in that broader narrative. So lots of work to come, but so pleased that we're at this point and working in collaboration with our partners in the county.
Thank you so much, Mr. Hands. I'm going to ask now Ms. Meredith Bowers, representing the Collaboration Council, just to say a few words on their behalf, and then we'll turn it over to HHS to kind of walk us through how they envision this working and implementation. But Ms. Bowers.
Good morning, everyone. I'm Meredith Bowers, the Director of Administration at the Collaboration Council for Children, Youth, and Families. I'm here on behalf of Elijah Wheeler, who fortunately received his booster shot yesterday. Unfortunately, is not feeling up to being here with us, but he sends his regards and his regrets for not being here. Collaboration Council is really thrilled to be a part of this pilot, and the most important thing for us is making sure, as others on this call have already stated, that the lives of those who are most affected by income volatility, particularly in light of COVID, are centered in this pilot. And we are looking forward to working with everyone on this call. And particularly thank you to the Meyer Foundation for bringing us into this work as a supportive planning partner in both the planning and the eventual implementation of the pilot. Thank you for having me here.
Thank you. Thank you. We send him our best. Hope he gets, I'm sure he will get better soon. All right. So I'm going to ask Ms. Harris and Dr. Mensah if you'd like to talk a little bit about implementation, sort of the timeline for that and how you envision that working. That would be helpful.
All right, good morning. My name is Oscar Mensah. I'm the acting chief and for Children, Youth, and Family Services and Social Services Officer for Montgomery County. I'm very excited about how far we've come. 2 years ago, we did a lot of brainstorming all around it. It's all like, oh, let's start. Let's stop a little bit. But the amount of energy that went into how far we've come is really tremendous. And thank you, Councilmember Jawando, for the energy that you brought to the group and the excitement that you generated among the group for us to come to this level. In order to do this, it's a lot of partnership that needs to happen. And it's a partnership between our colleagues at Department of Human Services at the state, specifically our Family Investment Administration team, and then also Social Services Administration team. We've kind of given them the heads up about what is about to happen and looked into some of the potential challenges, such as benefit cliff effect and how we can go about it. So at this point, the state, as I may call DHS, is waiting to hear for the final approval, and we'll be able to kind of work on some official notifications and letters to be able to finalize which kind of program that we can get waivers for and how we can move forward. We've also partnered with Meyer Foundation and Up Together on how to work together some memorandum of agreement. Because in order to do this, we have to write tons of agreement between DHS, DHHS, and the agencies that we are working with, such as Up Together, and then the evaluation team, and then any organization that we are going to partner with, because we cannot really do this in silo. So I like the partnership that we have so far. Right now, looking at how far we've come, we are looking at a broader planning team, and we met recently just to kind of talk about some of the big picture things, how we can really break down into subcommittees and then individually work through some of the contracting issues and then some of the memorandum of understanding in order to detail how we can operationalize this. Now, the most important thing to point out is how do we prevent our constituents from getting off their existing benefit? So for each individual or each participant that is going to be in this cohort, the idea is to sit down with the individual, go through the basic, the details of what is involved, and then how things are going to play out so that they don't really lose their existing benefit. So there will be an ongoing coordination to ensure that individuals don't get off their benefit. So as it stands right now, there's a lot to be done in terms of working through the contracts, in terms of working through the memorandum of agreement, and in terms of the partnership with our evaluators, because the best thing to do, as we've researched through the Stanton study and then other GBI that is going on, is to involve the evaluators right from the beginning, and which we have conducted some initial meetings, and we are excited to say that University of Maryland, Shady Grove, Morgan State University, and the College Park, they're all very excited about this and are willing to really work with us. In terms of timeline, at this point, we need to really break down into our subgroups in order to be able to come out with some specific timelines. It's very too early to say, okay, we're going to have this implemented right by the beginning of the year. Most likely, maybe first quarter, early part of second quarter, we can make some commitment, but there's some work that needs to be done before we can affirmatively say this is the day that we can really take off. There's a lot of work to be done behind the scenes, which based on the partnership that we have and the coordination that is going on between the partners, we believe that we're going to make some headway.
Thank you, Dr. Mensah. Ms. Harris, if you could talk a little bit about, we've received questions about how the families will be identified, and then of course how they'll be notified about this opportunity. If you could shed a little bit of light on that. I know that this is still a work in progress, but and also frankly provide some context. Your office in particular has been instrumental in ensuring that we provide rental assistance and some of the other federal resources directly to families and help streamline that to get them to them as quickly as possible and as efficiently as possible. That's also presented some opportunities because it's identified families that may have not been initially on HHS's radar screen who may also be able to benefit from this program as well. And by virtue of those relationships, better leverages the other support services that we're providing. So any light you can shed on how these families will be selected in any context you'd like to be provide would be great.
Sure. Thank you for the opportunity, and thank you, Councilmember Jawando and Vice President Councilmember Albernaz for your work on this. I'm really excited to be able to be part of this research project. I think it gives people a unique opportunity to make real choices instead of taking this very kind of paternalistic approach about helping people. I believe that people know how to make good decisions. They just don't have the money to do so. So very excited about this project. I think what I will say as far as context is this is only 100 units. So we have a tremendous amount of need out there, and we have seen through our emergency rental assistance program, and we've served over, at this point, we have prevented over 7,000 evictions, and there are still more people applying every day. So, and we serve about 2,500 individuals and families each year in our homeless continuum. So 100 slots is very small, exciting, but very limited. So what we're thinking right now is that this would be specifically for individuals and families that are in our homeless continuum. So not reaching those folks that are have housing instability or are rent burdened, because those numbers are just too large. So the idea here would be to focus on households that do not have significant case management needs. So not people that are in our permanent supportive housing programs, but people that have the potential to exit. So largely focused on households that are receiving rapid rehousing or through our COVID rent relief, which is basically a short to medium term housing subsidy with no case management, and targeting those that have been in the program for 12 months or more, or those that have recently exited. And the idea here is to see, does this make a difference so that they're not actually returning to the homeless continuum? Because we do still see about anywhere between 15 to 20% of the households that we serve coming back into homelessness within 2 years. So the idea here is to try and see if this prevents them from coming back into the continuum. And we do, because we're choosing from this very specific set, we'll have a natural control group. So we will be able to look to see, did this make the difference or not? The other thing I will say about this, I think it's really important that we figure out the evaluation piece and what kind of incentives we're going to be providing to the participants to ensure that they are participating in the evaluation. We did a direct cash assistance program earlier this year using the CRF, the Coronavirus Relief Funds. It was not exactly a guaranteed basic income because it was just a one-time payment. But it definitely helped. Only less than 20% of people have come back into the continuum, but we really struggled to get people to complete the monthly surveys. And we don't want to tie assistance to completion of a survey, but we do want to make sure that we are getting that information, because we want to look at not just the quantitative analysis, but the qualitative. Are people's lives better? Do they feel more hopeful? Do they have more time to spend with their kids? And the only way to get to that is to hear directly from them. So I hope that's helpful and provides some context.
It is. It really is. I'll just note a couple of sort of headlines here, and then Councilmember Glass has some questions or thoughts. So one of the major criticisms that we've received about this is that, you know, we have so many vacancies in the workforce, and that this is somehow going to prevent people from seeking those jobs. I'll just note several things. One, $800 is not enough to live on its own. So whoever is taking advantage of this opportunity will continue to work and have to in order for them to be able to, help their families and assist them. As I said before, it might mean 2 jobs instead of 3, 1 instead of 2, but people will still be employed. The other concern that we have raised, that has been raised, and we will be cognizant of this, is that this doesn't somehow unintentionally then prevent participants from accessing other services. If you, Ms. Harris, or Dr. Kroll, or Dr. Mensah could talk a little bit about ensuring that we don't have an unintended consequence of receiving this, but then no longer being eligible for something else. If we could talk a little bit about that, that'd be great.
So I'll start just very briefly, but then I think because there is a question both about the state and county benefits in this. The easy lift is that we will not exclude people from eligibility for any county funded or county sponsored benefits that are currently in place. So people will be able to get this benefit and in addition receive what we provide on an ongoing basis. So this would be additive, and there will be no cliff effect from our Montgomery County funding. The state funding is you heard Mr. Mensah, Dr. Mensah talk a little bit earlier about working with the state around what benefits we want to make sure are sustained and having to negotiate that. And I think that's what they're waiting to hear from us on now and to walk through with us. But Oscar can add additional details, and Amanda, if you want to flesh that out a little bit. I do want to say before I turn it over to them, though, that to your point about people concerned about whether or not this will inspire folks to not want to work. $800 is not a lot of money to add to people's lives. It's not enough to make them go from however many jobs they have now to 0 jobs because we're taking care of them. It is enough. It is a beginning of enough. Hopefully, we'll know from the pilot whether it's enough to make sure that to give people an opportunity to decrease their needs on county benefits over time, and so and to be able to get a job that pays them a living wage for Montgomery County. So all of those things are in this place. I don't think this is going to take away from the workforce in any kind of way. And we're talking about 300 people, so the data will tell us what we need to know as we go through this. So with that, I'll turn it over to, I don't know, Oscar, if there's something else that we need to add about the state that will help.
No, I will take this. It's important to underscore that this is a pilot, and we are evaluating and monitoring to ensure that this can drive a policy change in the future. So we're going to keep individuals on their existing benefits. And that is the reason why we are working with the state to get waivers to ensure that individuals continue to receive the benefit that they are receiving. Now, based on the level of income or where the individual is, there will be an individual assessment before the individual is selected or is included in the study, so that it can advise us that is GBI the right way to go or not. So we need to definitely underscore from A to Z that this is a pilot study that needs continuous evaluation, continuous monitoring for us to see the outcomes that we want to see. And again, an individual will not lose their benefit. It's something that we will partner with the state on it. Amanda, you want to add anything?
Yeah, if I can just speak for a minute about the housing component, the housing subsidy. So we are in conversation with HOC for people that may be in the pilot that are also receiving a federal housing subsidy. So they're trying to figure out a way if they can provide a waiver for that. For any of our local subsidies, that's easy, as Dr. Kroll said, that we can absolutely do the waiver. And then to Oscar's point, even with those folks that are receiving a federal subsidy, so the subsidy is based on your income, right? So you pay 30% of your income. So if you get this extra $800, you would have to pay 30% of that. So it still is a net gain. You still would be getting more money. So that's where those conversations with the participants to let them weigh their options. Do I want to do this or do I not? But even if they can't get a waiver, they still would get more funds than they would be without the program.
Terrific. I've got a couple follow-up questions, but I'm going to yield to Councilmember Glass, followed by Councilmember Jawando. Councilmember Glass.
Well, thank you very much, Mr. Vice President. And I didn't comment at the top because I wanted to get right into the heart of the discussion and appreciate everybody sharing their perspectives and all of the collaboration that has already taken place. And again, my appreciation to Councilmember Jawando and Councilmember Albornoz for leading on this collaboration, because that's how you do big things. And to have the support of Meyer and the philanthropic community is tremendous. And I'm glad to hear that Councilmember Rice, when he was attending the National Associations of Counties, the important work that we're talking about right now was talk of the town at NACO. So thank you for delivering that readout. The point I wanted to raise was just raised by Ms. Harris, and I was curious about how the funding that we appropriated for those people who were experiencing homelessness at the beginning of the pandemic, how that has turned out. And Ms. Harris, you'd said, I think the important takeaway is only 20% of those individuals have returned to the continuum of care. Is that right?
That's correct. Yes.
Yeah. So if we flip that, the direct assistance that we provided to individuals who were experiencing homelessness had an 80% success rate of them not returning. And that's wonderful. And so that is a very good foundation. And as you also stated, the support was not as robust as this support is going to be, and the metrics and the information gathering. And so we'll be able to refine it and learn more about these individuals so that not only hopefully we get an even better than 80% success rate on however we define success, but we can do better. And that will certainly help with the philanthropic community, because I've worked with Meyer in a previous life as a nonprofit executive director. And I know that Meyer is incredibly data driven, and that will help them. And they will, just like our work here is already filtering into the NACO conversations, Meyer will bring that to the philanthropic circles in which they are a large part of as well. So I'm encouraged by the previous work that we've done in this space, knowing that this is going to be even better. And so I will end on that optimistic note and appreciate all the work that is being done here and look forward to this future collaboration. I yield back.
Thank you, Councilmember Glass. Councilmember Jawando.
Thank you, Councilmember Alvarez. This has been a great conversation. Appreciate all the work and collaboration from everybody. And I just wanted to also say on the two questions that you raised, which are very important, we've received those. The third one is that we get a lot is, how do I sign up? And just to remind people here, for the millions watching at home, this will not be an application process or a lottery. We're going to work with community partners in a community-based engagement process that Collaboration Council will be leading and is funded by, thankfully again, and with Meyer, to identify and work with folks who are working with this population, and that's folks will be selected that way. So there's not, you haven't missed anything. There's nothing to sign up for at this point, and I just want people to know that. But to the point of benefit cliff and having enough money, I think it's also important to know that while there will be waivers and exceptions, because we want to evaluate, apples to apples here and oranges to oranges, and to know how folks can do, there has been some promising research, as I mentioned at the beginning, of folks improving their job situation, getting out of debt, improving their housing, and getting more educational opportunities, that has shown that at the end of the process, to the point of the transition, which would be another really key point, that they are less reliant on needing programs either from the county, state, or federal government. And that doesn't mean, that doesn't mean they won't need this extra supplement, right? That's kind of the core question we're gonna have to show, is like, is giving this money to folks so they have the dignity and flexibility? Because look, we know median income's 120,000 or so here, just under, and that we have the majority of our renters, particularly our Black and brown renters, are paying 30, 40, 50% of their income on rent. We know people are stretched to the max right now, and that's an unsustainable model to have, not even taking into account childcare and the like. And so hopefully we'll have some good news on childcare. We just had a great conversation last week about that, setting up a system for that. So can we package the right set of dignified supports around our residents so that they can make choices and improve the quality of life for themselves and their families? And I think that's what we hope to learn. And those waivers are critical to do that, and so that we have a good research set. But I do want to say that I think the early research out from programs that have taken place show that this can be a new model. And so I think both things are true, and we want to learn from it. I just wanted to say that because I know that's something that comes up a lot. And this idea finally I think when this story first came out, when we introduced, they got someone from the University of Maryland to say, well, there should be, who worked for the Trump administration, there should be a work requirement. Trust me, these folks are going to be working. We don't have to add a requirement. This is not some sort of use. I've always said, we don't have a work problem here. People want to work. We have a wage problem. People can't make enough to sustain themselves. And that's what this is in part trying to address with other things that we've done. And I appreciate Councilmember Glass mentioning the other programs that we've done here. And because I think we're trying to figure this out on behalf of our residents. So I just want to make those points, and if anyone wants to comment, they can, but I just wanted to make those points. Thank you, Council President.
Thank you, Councilmember Jawando. That was very well said. Councilmember Rice, then I'm going to come in the queue to close this out here. Councilmember Rice.
Oh, and I think Oscar, Mr. Mensah.
Sorry about that. Yeah. Go ahead, Dr. Mensah.
All right. I wanted to add to what Councilmember Jawando mentioned. The independence, the respect, the dignity that individuals get for getting money in their hands to make independent decisions goes a long way. When we go back to some of the research studies that were done, anxiety levels came down, depression came down, and those are all priceless. So as we talk about some of the outcomes, that is something that we definitely cannot forget about. And I just wanted to add that.
Excellent point. Thank you. Councilmember Rice.
Yeah, I just wanted to close out by saying a couple things because I think that it's really important for us to highlight, because we heard concerns from folks during the public hearing about why we were doing this, about the message that it sends. And the reality is this, is at the end of the day, and I'll just speak for myself, it is my hope that folks will have less reliance upon public services. So that investment that we have on the front end, this isn't something that's meant to be long-term. This isn't meant to be something that is going to go on in perpetuity. The idea is to be able to propel people to that next level, understanding that they've reached a ceiling that is not allowing them to break into that next sector by allowing folks to invest in themselves. And one of the very interesting things that we talked about in our National Association of Counties Prenatal to 3 conference was about many people who may be a part of this pilot, who actually are childcare workers, who really do want to invest in themselves to take them to the next level so that they can get to more of the excels, but just don't have the time because they can't step away to leave that other job that is keeping them from getting to that next level. You see, so it's kind of that cyclical. And so they want to do the extra work, but they can't afford to because they can't take away that income that's going to be there. Keep in mind, as a result of this, we may have people who will use this and go to school and get a certification, get a degree, and then utilize that to take them to the next level. That is a part of this cohort. So I just don't want that to be lost in that there's that education space, there's that lifting up, that's that part of this that's there where people assume this is just people taking a handout, where it's exactly the opposite. It's people actually being able to propel themselves to that next level in their lives, something that we all wish for, because as government, it means less reliance on services, but also the fact that you're more successful. You're making more money, which benefits all of us. So those who care about lesser, as Councilmember Duando says, the millions that are watching at home, who care about lower taxes, who care about less reliance on government and public service, this is a way to do that. So let us do the work. Let us get the data, as we always do, right? We're very data focused here in Montgomery County. Get the data and show people that this is working and it's doing what we want. That's a great thing for whether you're a fiscal conservative, a fiscal moderate, or a fiscal liberal. It doesn't matter. All across the board, everyone should be supporting this. So anyway, thank you.
Yeah, amen. Just a couple final thoughts and then a suggestion to this really amazing team here. So just to pull this string a little bit further, the timing of this couldn't be more important because there are obviously so many more families that are teetering on the brink of collapse. And when you think about this in terms of our children and youth, and the amount of those kids that are experiencing tremendous behavioral health challenges at the moment and are very behind academically, historically behind academically. What we found in the analysis in California and in other parts of the jurisdiction, families often utilize this to advance the education, not just of themselves, but of their children. And so we know that we need that additional layer of assistance right now too, which I think will be very important. Obviously, as has been noted, this pilot is more than just for families with children. It will benefit a wide range of residents, but I think that's important to note. I said 2, it's actually 3 comments. The second, it's been forwarded to me from colleagues at the state level representing different jurisdictions that there's a strong interest in making sure that this is geographically diverse, acknowledging that there are pockets of need all across this county, even in some of the higher end zip codes, which is absolutely correct. And so as we select families, we obviously want to make sure that we are identifying families regardless of where they live in the county, but that are in need and that will tremendously benefit from this as a community. So I think that's important to note. And then the third comment before the suggestion is there's also been some feedback, which I think is productive, that to the degree to which we can include a longitudinal analysis on this effort, that would be really helpful. That's, years, because there will be an initial bump, there will be an initial benefit, obviously, for especially within these 2 years, and hopefully the year or two after that. But the question is, for those, especially those families that invested in support for their children, does it show that those children, years from now are in a better position than they otherwise would have been? Because I think if we do this right, and I'm confident we will, then this will provide a unique opportunity for us to potentially shift the paradigm in thinking about how we support our families, rather than 17 different programs with 17 different applications, and that's complicated and overwhelming on a good day. This could help streamline things in a way that's even more effective if it shows that it in fact is. Final suggestion to the team is, after we vote on this next week, and a couple of my colleagues had a lot of questions, and that was another reason why we had this committee session first, rather than just have this directly go through consent calendar. So I hope they're watching in the audience and certainly follow up with their questions. But I do think it would be good for us to meet with either Nonprofit Montgomery or our Villages program or other key stakeholders who are connectors, to share with them what we're doing, because they're all very excited, but have lots of questions that understandably we're not in a position to be able to answer specifically right now. But I think shortly after the new year, it would be good for us to take this out to our key stakeholders and partners in the community, so that they can help identify potentially families that may help benefit from this, and we can continue the longstanding partnership we've had for many years now to maximize and leverage our resources. So with that, thank you all so much. Ms. McMillan, before I get to the vote here, was there anything that we missed that you wanted to cover?
I don't think so.
Okay. Can I get a motion to support this pilot program as a recommendation out of the HHS committee?
So moved.
Second.
All right. All those in favor, please raise your hand. That is unanimous. And I know Councilmember Joando, if he could, would vote on this as well. But this has been very helpful. I also want to give a shout out to my colleague, Beth Schuman, who's done a lot of heavy lifting on our team on this too. And her and Pam and Linda have formed a tremendous partnership here and have been really helpful in getting this over the goal line. So we will have a committee. This will go before full council on Tuesday. Will be voted out before the holidays. And we thank you all so much. And with that, we are adjourned.